I'll start.
Sir, we are live.
Hello, everyone. Today, I am going to talk about living with scleroderma. So, this session is for the awareness of the patients who are suffering from this disease called as scleroderma. So, scleroderma is a chronic connective tissue disease. Connective tissue disease means skin, muscles, bones, and joints. These are all type of connective tissues. And the word scleroderma comes from the Greek, in which sclero means hard, and the derma is Latin word that is skin. So hardening of the skin is the most important feature of the disease, and it varies from individual to individual. The disease it's not contagious, so it doesn't spread from one person to another. It is not infective disease. It is not a cancer. So what are the causes of scleroderma? So exact cause of scleroderma is not known. There are some genetic factors and some environmental factors which lead to the pathogenesis. That is, which lead these factors lead to the generation of this disease called scleroderma. So what happens in this disease? There is a overproduction of the collagen. That is the tissue in the skin, like fibrous tissue. So that collagen is overproduced. Along with that, there are changes in the blood vessels. Blood vessels. These small vessels are seen in the skin and in the tissues of the body. And in this side, right side, you can see that blood vessel which has damaged, like this thickness has increased and the diameter is narrowed. So there is a reduced blood supply. So how serious is scleroderma? The seriousness of scleroderma depends on the which part of the body it is affected and how much skin it is affected. So if there is more of skin involvement, then it can be serious. Apart from that, when there is lung or heart involvement is there, that time also it will be more serious. And in early stages, the disease can be mild, and if you don't treat it adequately, it can become serious. There are two main forms of scleroderma, that is localized scleroderma and systemic scleroderma. Systemic scleroderma has further two forms, which we will see later. But the localized scleroderma is just a local, that means affecting just one portion of part of the body, not the entire skin or entire body. And it is more commonly seen in children. As we can see here, in this girl, it is affecting only the forehead skin. In this picture, it is affecting the right hand. And in the fourth picture, it is affecting one side of the face. So as you can see, most of the patients here are children, so it is more common in children. And systemic scleroderma is more common in adults. It is more common in a female, and the most common age is 25 to 55 years of age, but it can occur at any age, from childhood to adulthood. So what are the manifestations of scleroderma? How does it present? So this first picture shows there is a skin tightening. So because of tight skin, you can see this patient is not able to open the mouth completely. Her nose has become stiff and straight, and forehead also, the skin has become tightened, and there are color changes. As you see, you can see there are white dots. So this is called as salt pepper pigmentation, which is seen in the patients of scleroderma. Second problem is Raynaud's phenomenon, in which you can see that there is change in the color of skin. That is, fingers have become white. I will talk about this in some time. And then there can be digital ischemia also, which is called as gangrene, dry gangrene, which can happen in patients of scleroderma, which is more common when the Raynaud's phenomenon is not treated adequately. Apart from this, other manifestations are this telangiectasias. Telangiectasias means these are so very tiny blood vessels which becomes dilated and they appear as a red mark. It can happen over face, it can happen over hand also. This in this photo, this manifestation is called as sclerodactyly. In sclerodactyly, because of severe tightness of the skin, the joints become fixed. They are not able to move. So you won't be able to move your hand properly. So it will be tightened because of tightened skin. Other thing is there are many gut issues. In the gut issues, there will be reflex of the food content. So whatever you eat, it might come out from your mouth, or you might get that sensation that it is coming out because this sphincter is there, that kind of knob there at the lower esophagus, it is not closed. So all these contents, it starts coming up because of the weakness of this muscle. Apart from that, the lungs are also affected, and heart is also affected. So there is increased difficulty in breathing. As I said previously, systemic sclerosis has two forms. So in systemic sclerosis, one is called as limited and other is called as uh, diffuse. This localized scleroderma we had seen before. So here we have other two forms, that forms of systemic sclerosis, that is limited and diffuse. In limited, the skin distal to knee and elbow is involved along with the face, whereas in diffuse, entire skin involving chest, trunk, back, all these parts are involved. So this image which I showed you, this is called as middle image is Raynaud's phenomenon. So Raynaud's phenomenon is the exaggeration of normal response to cold temperature. So whenever our hands are exposed to the cold temperature, cold water, the blood circulation gets decreased normally. But in these patients, that response is too much high. So their blood circulation completely gets decreased after exposure to cold weather or cold water. So they will become first white. There are three phases. First, they will become white. Then, when the residual blood will circulate there, then they will become blue. Cyanotic means blue. And when the blood flow is normalized, then they will become red. So there are three phases. First, they will become white, then blue, and then red. This is called as triphasic response. Usually, pain is not present unless the episode is very severe, and most of the time it doesn't last more than 15 minutes. But if it's left untreated, it can last longer and it can come often and often, more frequently, and it can lead to the digital ulcers. So Raynaud's is treated by educating the patients to avoid the common provoking factors, and that most importantly is the avoidance of the cold temperature, and put warm clothings and stockings and headwear, and take proper protection measure from the cold. So here, as I have shown, you can use the gloves during the cold season, particularly the woolen clothes. Avoid the high speed fan, or overnight keeping the hand under the high speed fan, or while traveling, the keeping hand out in the cold breeze of air, that these factors can aggravate the symptoms. Drug therapy. Calcium channel blockers are the most commonly used drugs. They are the traditional drugs like nifedipine. And now newly few drugs have come, and many newer approaches are also coming, including the injections and other therapies. So most important thing is there is lot of treatment options are available, but patient should adhere to the treatment. That is the most important thing, and patient should avoid all the cold related situations so that the Raynaud's should not get aggravated. The next thing is pulmonary hypertension. Pulmonary hypertension is like one vessel in the, like one blood vessel which is associated with the heart, which brings the blood from heart to the lung. So that vessels, there is increased pressure. So because of that, there is it puts more pressures on the heart. So because of that, you might feel dyspnea. Dyspnea means breathing difficulty, which initially is more common with exercise, but later it can happen even at the rest also. You can get chest pains, and you can get swelling of the feet and legs. And other symptoms are palpitations, like the sensation of heart racing or fluttering, along with lightheadedness. So for this also, there are multiple medical treatment or intravenous treatment are available, and this has to be taken as per the advice of the rheumatologist. If it is not treated properly, or it is very severe, then lung transplantation is the last option. Even for this heart, like pulmonary artery hypertension, and even ILD, interstitial lung disease, which affect the lung, for that also lung transplantation can be opted. But such a condition can be avoided if you are taking proper treatment from the onset of the disease and following the doctor's advice regularly. So, what are the managing strategies? Most important is to, as I said, adherence to the medication and regular treatment under rheumatologist. Then exercises, which helps the circulation, flexibility, and stiffness, and which can improve the day-to-day quality of life. Then protecting the skin with use of sunscreen lotions and uh, treatment advised by the doctors. Avoiding smoking. The heartburn, which I said it happens because of the reflux, it can be avoided with proper food intake by avoiding the food which can aggravate the symptoms like spicy food or deep fried items, and by keeping a gap of 2 to 3 hours after having dinner and between the sleep. So all these factors can reduce the symptoms, and if required, antacid medications can be used. Protection from the cold, as discussed, and again, the coping mechanisms like trying to take charge of your illness and have a sense of control and balance difficult parts of your life with positive things like exercise and fun activities. This can help to boost up the strategies. Apart from that, emotional well-being and mental strength is also good, so that mind-body coordination techniques like pranayama, yoga can be done, which can enhance this emotional well-being. Family support is also very much important. Patient education. So patient to be educated about the disease, its complications, treatment adverse events, and effect of the treatment on time to time basis. And they can go and meet their doctors anytime in case of any doubt, and shared decision making. So before taking any decision regarding the medications or regarding starting the medication, stopping the medications, so what are the pros and cons should be discussed with doctor and should be understood. That's it about the living with scleroderma. Thank you.